Good morning, good afternoon, good evening, wherever you are in the world. Good day. My name is Brian Oldenburg from the University of Melbourne, and it's my pleasure to be giving this lecture on training and capacity building capacity for implementation science in low middle income countries. Over many years now, there's been many different networks that have emerged and been developed globally to advance and deal with the challenges of many different global health issues. And most recently, this year, in the last 9 months, we've seen a number of networks established, particularly led by the World Health Organization, for example, to tackle the big challenge of COVID. But over many years, there's been less emphasis given to non-communicable diseases or chronic conditions, and that's what I'm going to talk about in this lecture today. And in particular, I'm looking at how to improve the research capacity of low and middle income countries to deal with and address non-communicable diseases and NCDs. And almost 10 years ago now, I was the principal investigator of a program funded by the US National Institutes of Health, a so-called D43 grant, over a number of years to develop a program between Malaysia, Sri Lanka and India, which focused on helping early and mid-career researchers to develop their research capabilities and the institutions where increase also the capacity of the institutions where they worked and the countries and the regions. And in the last year, we published a review of that program and an evaluation. And that, for me, was a very important program because it got me thinking a lot about how we could do a much better job of improving and enhancing the research capabilities of early and mid-career researchers like yourselves, like all of you in this third implementation research training program that we're conducting with GACD for the last 2 weeks. Actually, following that program, or overlapping with the end of that program 3 or 4 years ago, we initiated another program called the Encore program, Excellence in Non-Communicable Disease Research, between Australia and India. And this was a cross-institutional program that we established between the University of Melbourne, the Sri Sritra Tirunal Institute in Trivandrum in Kerala, the Christian Medical College, Vellore, so-called CMC Vellore, also the Public Health Foundation of India, and also the All India Institute of Medical Sciences, AIMS. So we built these networks between the University of Melbourne and these 4 very famous health and public health research institutions in India with Australia. Then I've also been thinking a lot about the Global Alliance for Chronic Disease, and GACD commenced its life about 10 years ago now, had its first call, I think it was about eight years ago, related to hypertension, and has then gone on from strength to strength since that time. And I've been reflecting on how, as the GACD has developed its research programs, the number of agencies who are part of the network with GACD, the countries where the projects have been taking place, all of the studies and research projects, which would now, I think, be more than 100, the amount of funding, the number of institutions involved, but most importantly, the number of researchers involved, and how this has become a very impressive global network for building and enhancing research capacity around the world related to improving the prevention and control of NCDs. And if you look at the website of GACD, you'll see that it states that its mission is to reduce the burden of chronic NCDs in low and middle income countries, but also importantly, also looking at the vulnerable populations in high income countries, particularly Canada and my own country here in Australia. And GACD advances its mission by investing in research, which is funded through the health and medical research funding agencies that are part of the network with GACD. It builds implementation science capacity and capability, and you're part of one of those initiatives and programs with this research training school. And the other very important thing is it facilitates collaborations and partnerships. So these are all important elements of building a network. And the workshops and the training that we've developed over the last 8 or 9 years are a very important part of building this network and a core part of GACD's mission. And since the first workshops that we conducted in 2014, the curriculum, as listed on this slide, has not changed that much. The way in which we've delivered that curriculum and the depth and detail of that curriculum and how we've done that has changed and evolved over time. And I'm going to talk a bit about that during this lecture today. Here is a slide which shows some of the faculty and participants from the very first annual scientific meeting that was held in Xi'an, China in 2014, which was where we held the first workshop. The first GACD implementation science workshop was held in Xi'an, China in 2014 in collaboration with the China Academy of Medical Sciences, called CAMS. And then since that time, we've held workshops and training, 2 days, and other kinds of workshops and training in many countries around the world. We've always, since 2014, we've always held some workshop or training associated with the annual scientific meeting, but then we've also held a number of other workshops and training as well. Then last year in Bangkok, we held the second research training school, which followed the first training school, which was held in Brazil the year before in 2018. And both of these were 2-week programs. And here's a wonderful photo of all of the participants of the second training school in Bangkok, almost exactly 12 months ago. And if you look closely, you'll see a number of the faculty who were also teaching in that program, and you'll also see some of the trainees in the audience there, the participants who now have become facilitators in the program we're conducting this year. And you can see Katrine on the left and Tillahan on the right, who were participants in last year's program and now are facilitators in this program. Here you can see just an overview of the statistics, some of the details of the trainees over the programs that we've been conducting since 2014. And you'll note, I think importantly, that most of the participants are either living in low and middle income countries or come from those low and middle income countries, quite often currently studying in other countries and so on. In fact, I would say that the number of attendee or the number of participants we've trained is much higher than that number now. It's probably closer to 8 or 900, and even more if we consider other workshops and training which have sort of spun off from the GACD program. One of the things which is important in my mind, and particularly as we are a collaborating centre for the World Health Organization on implementation research to improve NCD outcomes, I think a lot about not just how to improve the capacity and capabilities of people like you as early and mid-career researchers, but also how it's possible that people like you can work more effectively with governments and other kinds of implementation organisations and partners in your countries, because it's by creating not just a global network by GACD, but more local, national and regional networks that connect researchers with policy organisations, universities, implementation organisations, NGOs. All of those connections create local networks which will build more effective national capacity for implementation research to improve health outcomes in your country. And that the guide that we wrote 4 or 5 years ago for the World Health Organization on implementation research was really written to help policymakers and program implementers to kind of understand more about this rapidly developing field of implementation research or implementation science. And in that, we proposed a model which talked about the 4 steps for implementation: identifying a problem, adapting and piloting an approach to addressing that problem, then looking at a fuller and more detailed implementation, and then progressing to scale up. Now, of course, those steps don't go sequentially and they don't necessarily go quickly, but thinking about that longer term vision and plan is important for implementation. And then what we proposed was that for each of those steps inside this circle are important research questions that one might want to answer. So for example, one question about identifying the policy or intervention is how will appropriate policies and interventions be selected? Or if it's about adaptation of a program or policy from somewhere else, how acceptable might this new policy or intervention be in this new context, and how will it be adapted? And similarly, there are questions related to each of the stages. The step 4 of scaling up is also very important, to be thinking about not just the project that you're working on at a point in time, but how might that program, policy or intervention or those strategies be more widely deployed in a region or a country? How are they going to be more widely implemented and scaled up over time? So in the monograph that we wrote for WHO, we particularly stressed the scale up stage. As part of the work with the World Health Organization, but also spinning off the learnings we were deriving from how to do this kind of implementation science training around the world, we also conducted training in collaboration with the World Health Organization, and one of the important programs we conducted was in Moscow last year, which had participants from all over Russia and many other countries in Eastern Europe and that part of the world, which was a very exciting program to participate in. Out of that training program, actually, with the other faculty who were involved with that program, we thought a lot about contextualization and adaptation of programs and how important this is. And this is an area that we haven't really given enough thought to and haven't researched this enough. And we were sufficiently motivated by our discussions on that topic to write this paper, which was subsequently published last year in the British Medical Journal, called One Size Does Not Fit All, Implementation of Interventions for Non-Communicable Diseases. The other great thing that's happened as a result of the GACD training we've been doing is a number of other initiatives have spun off through the through some of the health and medical research funding partners of GACD. So, for example, the funding partner from Japan, after we conducted a program, their training program in 2018, they have subsequently formed their own network for D&I science in their country, and they have now subsequently been running national meetings and other events. And in fact, they have developed their own network called RADISH, the Research Association for Dissemination and Implementation Science in Health, which involves researchers, policymakers, and program implementers in Japan. And they conduct annual meetings. And if you look at this photo, you can see Dr. Rajesh Vedanthan, one of our faculty from this program, was an invited speaker to be involved with the annual meeting that they held in Japan in 2019. They have subsequently also translated the WHO manual into Japanese, and then also the manual is being currently translated into Chinese as well. So it's great that this whole excitement about implementation science to improve NCD outcomes around the world is really taking root in many different countries and parts of the world, and this is really very, very exciting and satisfying. As part of the GACD network, we've not only been doing, or GACD has not only been supporting the training, both the shorter 2-day training and the longer 1 or 2 week program that you're now part of, but there have been a number of other initiatives as part of the GACD network, which I think have been really fantastic for developing the whole capacity of that network and the researchers to have more impact locally, nationally, and globally. So, for example, one of the things that happened in the first 3 or 4 years of GACD was to develop some guidelines for joint publications. If you've got 30 or 40 different research projects going on around the world in a particular thematic area like hypertension or diabetes, how can you involve all of the researchers and have those people actively participating in publications? How do you deal with issues of authorship and related kinds of issues? So that was an issue that we tackled in these guidelines. You can see any more information about any of these issues if you just go to the GACD website, www.gacd.org. The other thing is, in association with the annual meetings, we also ran some other forums. So in 2018, we ran a forum on Scale Up and just invited all of the researchers coming to that annual scientific meeting to be part of that forum, which happened on the day before the annual scientific meeting. And as I've already touched on when I was talking about our WHO monograph, you know, scaling up is really a very important challenge and a very important issue, and we need to give much more attention to it in implementation, in the field of implementation science, thinking about the methods, how to do it, etc. After the good success of that Scale Up Forum in 2018, we decided last year, almost exactly 12 months ago, to have another more focused meeting on Scale Up, which asked the question, how do we assess and evaluate whether complex interventions can improve NCD outcomes, and are they scalable? And we had some very interesting presentations from economists and others to talk on this topic. Now, of course, you've all joined this program in 2020, and as I described in one of the earlier lectures in this school, this course went virtual, or the decision to take it virtual happened 3 or 4 months ago, and we then worked pretty quickly to work out how to do this, how to get the technology working to deliver the school, and how it was going to be possible for almost 50 people like yourselves from around the world to participate in a program like this 24/7. And we were reasonably confident we could do this, but there were many details which we didn't really understand, and we've also learnt a lot as we've been running the program the last week. We adapted the program from the previous 1-week training schools that we conducted in Thailand and Sao Paulo in Brazil. We involved many of the faculty who have been involved in the program, but very importantly, we really increased the role and the important contribution from the facilitators, who I'm sure you will agree over the last week have been very involved in the small groups and have really helped to deliver the program in a way that, if we just had the lectures, I think would have been a pretty dry program and really wouldn't have enabled the amount of interaction and contributions from all of you. The technology has, I think, come together pretty well, but we'll do a more deep evaluation of that after the school has finished. So what are some of my concluding thoughts about this journey, and to reflect on GACD as a really exciting network to improve NCDs globally? And I'd like you to reflect on these issues, because in our final plenary on Friday, we would like to talk to you about how the network that has begun to evolve as part of this school could continue into the future, and what might that look like. So very keen to get your thoughts and ideas on that, which you can start perhaps putting on the Padlet, and we can discuss those in more detail on Friday. As I said at the beginning of this presentation, just when you look at how the GACD program and the network has grown and expanded over time, and you can use different metrics to evaluate that spread and that ripple effect over time, the number of funding agencies involved, the number of countries involved, the number of projects, the amount of funding, the number of institutions, the number of researchers. All of those, I think, are metrics which indicate growth and expansion over time. And some of the GACD researchers have also reflected on these issues and thought about how and why this has happened, and what are some of the more deep processes that have been going on in terms of communication and interaction amongst the researchers and the funding agencies, which have enabled that growth and expansion to occur, and to see the links deepening over time. And this is an example of one of the papers written by Ruth Webster and a number of other GACD colleagues, which characterises some of the very exciting activities which have gone on as part of the development of this network globally. The other part of it, though, which is not so obvious, although if you kind of start to think about it, or attend any of the GACD annual scientific meetings, or you even get a bit of a flavour of it through this school with the deep interaction between the us as faculty and the GACD Secretariat in the UK is you know, the deepening engagement at all levels. So yes, the engagement has been deepening and extending among researchers, and you are again another example of that, because I predict that all of you have been developing interactions and learning more about your peer researchers as part of this program. And I'm sure all of you will maintain contact and interaction with some or all of those people, and then hopefully we can also build a broader network out of this school as well. So that engagement at that level is kind of obvious, and you know, we've been developing the training programs and the capacity building to really deepen and extend your experience, your knowledge, your capabilities, so then you're also able to engage with your local communities and potentially set up your own networks, etc. But there's also this interaction going on with the funding agencies as they learn more about the field of implementation research, because right at the beginning, 10 years ago, most of these funding agencies, except perhaps the US National Institutes of Health, have not had much experience with this field of implementation science. So even just knowing what the word means and a lot of the terminology and then the methods and the science, they have been learning as well. So they have been learning from one another, but then those agencies have also been participating in the annual scientific meetings. Often people from those agencies have been on some of our panels at the workshops and the training schools. So there's been a lot of other interaction going on between the agencies and the researchers. So stepping back from all of this, I would say, you know, with this GACD network and building this network for sort of extending the expertise and building expertise and capabilities globally in implementation science for NCDs, where we've moved from baby steps to maybe childhood, pre-adolescence. Maybe we're in adolescence, but there's still a long way to go. And if you just look at the agenda for NCDs, and this slide comes from a meeting I attended with WHO about 3 or 4 weeks ago. The agenda is a pretty challenging one, because on top of what we already knew to be the challenges of NCDs, now we've got this additional challenge of COVID-19 really bringing more focus to NCDs and more challenges to the to manage NCDs, manage NCDs in different ways from the ways we've been managing them in the past, using more virtual care delivery, using different technologies, strategies to build up primary care, etc. So that brings me to the end of my lecture. Hopefully there's some food there for thought, and please think about networks and what kind of networks you could be involved with in the future following this program finishing on Friday, whether it be as part of a GACD sort of network for implementation research for people like yourself in the future, or whether it's other kinds of networks in your own country or more globally. I think it's very important to think about these. Thank you very much.